Thanks, Sally. Can everybody hear me okay? Of course. I don't need the microphone. Well, I am very glad to be here, and I want to thank the ANNA for bringing me back. I was actually here a couple years ago to speak and talked about conflict and patient discharge. So now I'm 2 for 2 with fun topics, depression and conflict and patient discharge. So if y'all want to bring me back to talk about bunnies and rabbits and balloons or something like that, I'd be happy to come here. So I'm just very glad to be here, and I'm glad to see that we have a big room, and I'm glad to see that we have a good turnout. Because what we're going to talk about today is such a critical issue for our patients. And I'll tell you, over the last couple of years that I've been doing a lot of education to healthcare providers about depression, this is a big issue for all of us as well as healthcare providers. So what I find is we usually get a twofer here. We usually talk about depression in our patients, but as providers, we get to learn a little bit about this illness that impacts many of us. So with that said, let's just do a little background about depression, and then we'll get into talking a little bit about the training that's available to you, and hopefully some of you, I'll ask for a show of hands in a little bit, but hopefully some of you have been able to take it and can maybe even share some of your experiences. So who gets depressed? When you're talking about general rates of depression in the United States, you're looking at about a 7% annual rate of depression across the United States. Now, when you start to factor in all mood disorders, which includes all the types of depression, bipolar disease, dysthymia, subclinical depression, major depression, etc., you're talking about 20% of all Americans on an annual basis. So when you exclude children, you're looking at nearly 20 million Americans every year suffering from a mood disorder of one type or another. Unbeknownst to many people, it's certainly not unique to the United States. By 2020, the World Health Organization is telling us that depression will be the second leading cause of disability worldwide. And the presence and the trend in depression is that it's increasing everywhere. All economic groups, all racial, ethnic groups, genders, it's on the rise. And we don't, quite frankly, know why. And of course, it's a real problem for our patients who are living with a chronic illness, particularly diabetics, hypertensives, people with hypertension, which obviously is our 2 greatest contributors to end-stage renal disease. And in addition to that, for the people who are taking care of our patients, guess what? It increases their risk of depression. It also increases the presence of depression in an individual with chronic illness and has a caregiver. That caregiver also experiences increased problems with other physical health problems. So depression is this rather deep driver that impacts so many different aspects of our life. And I don't even put any of the data up here from the workplace, but its most recent estimates put the cost of depression in our workplace at between $70 and $80 billion annually. It's far more expensive than any medical disease, any cancers. I mean, it's the most expensive thing out there. And it's just not quite getting the attention yet we need it to really have. And since, like I said, it becomes kind of a twofer, I'm going to throw a couple other statistics up here and tell you a little bit about some of my own experiences that I've seen in both clinical and my personal setting. Healthcare providers, i.e. everybody sitting in this room, suffers from major depression at about an 11% annual rate. So that's 4% higher, almost 4.5% higher than the general population. And I needn't tell you about how stressful it is working in a dialysis center. And stress is probably one of the greatest contributors to people falling into major depression. Women, again, not necessarily news, but it's about a 3-to-1 ratio when you compare it to men. So if we go through this room and, there's not a whole lot of guys in here, and I have my own theory about why this is so high, which is that men won't stop to ask for directions, let alone admit they're depressed, right? So, but this is generally what we see. We see that women suffer from this at a far greater rate than men. When you look at lifetime prevalence versus annual prevalence, we could go through here for all the women and count off 1 through 4, and everybody who's a 4 is likely to suffer from a major depressive episode over the course of their lifetime. Men, again, it's about 10%. But some of the classic symptoms that we think of when we think about depression, the sadness, the tears, those sorts of things, men usually don't present that way with depression. They present with anger and irritability And frequently, the diagnosis just simply isn't made when it certainly could be there. And then also, I'm going to just share a little bit about what I've gone through with my own battles with depression. Because not only have I been a clinical social worker for 15 years, I was diagnosed and dealt with major depression. And very interestingly enough, my time in the dialysis center, which is probably what really put me over the edge ultimately. But I've had the chance to not only be a professional, but to be a patient and to really learn what it means to be somebody who's had depression. I was diagnosed 21 years ago in college. I was stressed out. It was my junior year of college. I remember going to the counseling center, and the psychologist said, "You have depression." And I said, "That's great," and I got up and left. I mean, I didn't want to hear anything about that I had depression. There was no way I was going to deal with that, or I was even going to face it. And then I lived my life for probably, it was about 14 years that I had. I got married, I had children, I started my career, I got my graduate degree. But during that time, I would have these ups and downs with my depression. Sort of dealt with it better than others at times. But clearly, as I look back, it's significantly impacted my ability to do my job, to participate in my family, and to really be present for my wife through all of this time. And then things got bad the minute I got promoted to be a facility administrator of a dialysis clinic. So don't let this discourage any of you who are facility administrators, but I have to tell you the truth. And I think what's important to take away is that as professionals, we really have to take care of ourselves. But it was about 7 years ago that I really started to struggle with my depression and my anxiety. And it got so bad that it got to the point where committing suicide and taking my own life started to become the only real option I felt like I had. And I will tell you, in all frankness, I left my job as the administrator with less than a 2-week notice. Because things had gotten so bad, I walked off my job. And it was really, not the time to be making those sorts of decisions, because obviously when you're under the stress and duress of depression, as our patients are many times, you don't want to be making those big life changes. But unfortunately for me, it didn't end there. And then, like I said, I ended up quite suicidal, and I ended up spending 10 days in a psych hospital. Now, again, when I look back, or even today as I stand before audiences and talk about it, it doesn't quite seem possible that that happened to me. But the point is it can happen to anybody, and it does happen quite frequently. When I look back on those wonderful 10-filled days I had, I look like a different person. I weighed 40 pounds less than I weigh today. I couldn't think straight. I couldn't sit in a chair for more than 5 minutes at a time without my anxiety kicking in. I could hardly carry on a conversation. I couldn't sleep. I couldn't eat. I couldn't take care of my newborn daughter. I couldn't do anything. And yet here I am now, thanks through better living through pharmacy and other lifestyle changes, at least on the right side of where I want to be so I can talk about this.